Namaste. Myself, Dr. Vislavath Srikanth, Assistant Professor, Grameen Ayurvedic Medical College and Hospital, Terdal, Bagalkot District, Karnataka. I welcome you all to the Amruta Ayurveda video series from GAMC studio. In this video, I am going to explain in detail about food allergies and their prevention management. Food allergy. It is an immune system reaction that occurs soon after eating a certain food. Even a tiny amount of allergy causing food can trigger signs and symptoms such as digestive problem, swollen airways. In some people, a food allergy can cause severe symptoms or even a life-threatening reaction known as anaphylaxis. So, here the food allergy affect an estimated 6 to 8% of children under age 3 and up to 3% of the adult. While there is no cure, some children outgrow their food allergy as they get older. It is easy to confuse a food allergy with a much more common reaction known as food intolerance. While food intolerance is a less serious condition that does not involve the immune system and is triggered by several different mechanisms that are distinct from the immunological reaction responsible for the food allergy. See, food allergy in India and Asia. So, what is the prevalence and incidence rates? Although we often think of allergy as a Western disease, in reality it is fast becoming a global problem. In many Western nations, allergy rates stand at around 40% of their populations or sometimes higher also. It may surprise you, but India is not far behind, and with an estimated percentage of 25% of the population of the Indian now having at least one allergic condition. India, with a diverse and unique food culture, has acquired its own portfolio of allergens too. Nuts and wheat and dairy and other food products can be a problem to South Asians. But research led by Professor Mahesh P.A., Director at Allergy Asthma Association in Mysore, India, has uncovered many other allergens like with brinjal, cucumber, lady's finger and papaya among the most common food causing clinical symptoms in population samples from Mysore city and from the Bangalore. With a population of well over a billion, food allergy could become an enormous problem in India. Some estimates suggest that up to 3% of the Indians may already have food allergens, the majority under 40 years of age. Food allergies cause roughly 30,000 emergency treatments and 100 to 200 deaths per year in the nation. Up to 3 million Indians may have peanut allergy alone. So, see some facts regarding food allergy. Food allergy is not common but can be serious. Food allergy differs from the food intolerance, which is far more common. The more frequent type of the food allergies in adult different from those in children. Children can outgrow their food allergy, but adults usually do not. The diagnosis of food allergy is made with a detailed history, the patient's diet, diary or an elimination diet. Food allergy is treated primarily by dietary avoidance. Look at what causes the food allergies. The food allergies are caused when the immune system mistakenly treats protein found in the food as a threat to the body, when in fact they should be harmless. It then releases a number of chemicals to prevent what it seems as an infection taking hold. It is these chemicals that cause the symptoms of the allergic reactions. So, any food cause an allergic reaction, but there are certain foods that are responsible for the most of the food allergies. In children, the food that commonly causing the allergic reactions are milk, eggs, peanut, fish and shellfish, wheat and soya. The symptoms what we observed with these food allergies are: in children, abdominal pain, constipation, cough, decreased hearing, diarrhea, earache, eye discomfort, redness, fever, headache, joint pains, nausea, vomiting, etc. In adult, we can observe the food allergic symptoms are abdominal pain, blood in stool, chest pain, constipation, cough, dizziness, diarrhea, eye discomfort, redness all over the body, and heart palpitations, low backache, nausea, vomiting, neck pain, wheeze and sore throats, and some urinary problems. Let us see individual food that causes the allergy. First one, peanut allergy. As I mentioned, the peanut allergy is the most common allergic found in Indian peoples. So, here the peanut allergies tend to be lifelong, although studies indicate that approximately 20% of the children with the peanut allergy do eventually outgrow their allergy. Here the trace amount of peanut can cause an allergic reaction. Casual contact with the peanut, such as touching the peanut or peanut butter residues in any food, is likely to trigger the severe reactions. An estimated 25 to 40% of people who have peanut allergy are also allergic to tree nuts. In addition, peanuts and the tree nuts often come contact with one another during the manufacturing or processing of the foods. For these reasons, allergists usually tell their parents with a peanut allergy to avoid tree nuts as well. Avoiding peanuts. The Federal Food Allergen Labeling and Consumer Protection Act FALCAPA requires that all packaged food products sold that contains peanut as an ingredient must be listed the word called peanut on the label. So, then only the consumer can get whether the product has peanut residues or peanut products or not. Now, read all the product label carefully before purchasing and consuming. Ingredients in packaged food products may change without warning, so check the ingredient statement also. As of this time, the use of advisory labels such as may contains, there is a box called may contains on packaging food is voluntary and there is no guidelines for their use. Avoid food that contains peanuts or any of these ingredients. The peanut contents can be found in the artificial nuts, beer nuts, cold pressed extruded peanut oils, ground nuts, then mixed nuts, monkey nuts, nug meat, nut pieces, peanut butter, peanut flour and peanut protein hydrolysate. Peanut is sometimes found in the following food also: baked goods like cookies, candies, pastries, chocolate candies, chilies, egg roll and mole sauce, nuggets. Next one is the milk allergy. Allergy to cow milk is the most common food allergy in infant and young children also. Symptoms of milk allergy reaction can range from mild such as swelling, redness to severe symptoms like anaphylaxis. Therefore, it is advised that people with milk allergy have quick access to an epinephrine auto injector at all the times. To prevent a reaction, strict avoidance of cow's milk or cow's milk product it is essential. Sensitive to this cow's milk varies from person to person. Some people have severe reaction after ingestion of the tiny amount of the milk, others have only mild reactions after taking the cow's milk in a moderate amount. Reactions to cow milk can be severe and life threatening also. Difference between milk allergy and lactose intolerance. So, milk allergy should not be confused with a lactose intolerance. A food allergy is an overreaction of the immune system to the specific food. When the food protein is ingested, it can trigger an allergic reaction that may include a range of symptoms, small symptoms, mild to moderate symptoms like fever, rashes, swellings, such as the mild symptom, and moderate to severe symptom are troubling in the breath taking and wheezing, loss of consciousness, etc. Sometimes a food allergy can be potentially fatal also. So, unlike food allergies, food tolerance do not involve in the immune system. People who lactose intolerance are missing the enzyme called lactase, which breaks down lactose, a sugar found in milk and dairy products. As a result, lactose intolerant patients are unable to digest these foods and may experience symptoms such as nausea, cramps, gas, bloating and diarrhea, while lactose intolerance can cause great discomfort and is not life threatening. So, this is the difference between the lactose intolerance and milk allergy. Now, see the food avoid that contains the milk, cow's milk or any of these, like the person should avoid butter, butter fat, butter oil, butter acid, butter mixes, then cheese, cottage cheese, cream, curds, ghee, half and half, then lactalbumin phosphates, milk, protein hydrolysate, then rennet, season, sour cream solids, and yogurt, whey protein hydrolysate and whey should be avoided. Milk is sometimes found in following food also, like artificial butter flavor, baked goods, caramel candies, chocolates, lactic acid and margarines, non-dairy products and nuggets. So, before purchasing any milk product, a person should see in this label all this, whether if these contain, then person has to be avoid. Next, I am going to explain about the egg allergy. Let us see what is egg allergy, how it is affecting and what are symptoms comes. Egg allergy is one of the most common food allergy in children, second only to the milk allergy. Symptoms of an egg allergy reaction can range from mild such as rashes to severe such as anaphylactic reactions. While the white of an egg contains the allergen proteins, patient with an egg allergy must avoid all egg completely. This is because it is impossible to separate the egg white completely from the yolk, causing a cross contact issue which again causes the egg allergy. Now, we will see egg allergy and vaccines. What is the relation between them? Some vaccines contains egg protein. The recommendation of the American Academy of Pediatricians acknowledging that the MMR vaccine can safely administer to all the patient with egg allergy. Influenza vaccine usually contains a small amount of egg protein. If you or your child is allergic to egg, speak to your doctor before getting the vaccines. Now, the food which should avoid to stop this egg allergy: albumin, egg dried powder or solid, white or yolk, then lysozyme, oval albumin, surimi, then margarine powders, all should be avoided because it all contains the egg protein. And eggs are sometimes found in some of the products, foods like baked goods, egg substitutes, lecithin, marzipan, nugget and pasta. Here I will give some unexpected source of egg. Eggs have been used to create a foam or topping on especially coffee drinks and are used in some bar drinks also. So, some commercial brands of egg substitute contains egg whites. Most commercially processed cooked pastas also contains the egg proteins. Egg wash is sometimes used on before they are dripping in a salt. So, before taking any fruit products, read the label or ask the person about the ingredients before eating any products. Next, we have wheat allergy. A wheat allergy can present a challenge for the diet as well as for baking, because wheat is the nation's predominant grain product. Someone on a wheat restricted diet can eat a wide variety of food, but the grain source must be something other than the wheat. So, in planning a wheat free diet, look for alternate grain such as amaranthus, barley, corn, oat, rice, like this. Now, see difference between wheat allergy and gluten intolerance. Celiac disease, which affect the small intestine, is caused by an abnormal immune reaction to gluten, usually diagnosed by gastroenterologist. It is a digestive disease that can cause serious complications including malnutrition and intestinal damage, and if left untreated, individual with a celiac disease must avoid gluten found in wheat, barley and sometimes oats also. So, here the people who are allergic to wheat often may tolerate other grains. However, about 20% of the children with a wheat allergy are allergic to other grains also. Be sure to ask your doctor whether food containing barley, oats are safe for your children or not. Whether your child should eat that or not, you should ask your doctor. Now, see, food which contains wheat or any form of the wheat ingredients are bread, bulgur, cereal extract, club wheat, then flours, all type of flours, then pastas, then wheat bran oils, then wheat germ oils, wheat grass, wheat protein isolated, whole wheat beans. Food allergies, major food allergic product which may cause mild to severe symptoms. I hope this topic is useful to you in understanding food allergy and the food which makes or the food which has the food which causes the food allergies. Now, I would ending my speech on this small topic. I would like to thank our management team of the Grameen Ayurvedic Medical College and principal sir for providing opportunity to speak on this topic in Amruta Ayurveda video series. Kindly do like, comment, share and subscribe our GAMC YouTube channel. Thank you.